Another day, another story. Blood pressure refers to the force that blood exerts against the walls of blood vessels as it circulates through the body. Blood pressure is measured in millimeters of mercury, mmHg, and is typically expressed as two numbers, such as 128ths of a millimeter of mercury. What are the types of blood pressures? There are two types of blood pressure. Systolic blood pressure. This is the higher number in the blood pressure reading, and it measures the pressure in the arteries when the heart beats and pumps blood. Diastolic blood pressure. This is the lower number in the blood pressure reading, and it measures the pressure in the arteries when the heart is at rest between beats. Blood pressure readings are typically expressed as two numbers, with the systolic pressure listed first and the diastolic pressure listed second. For example, a blood pressure reading of 128ths of a millimeter of mercury indicates a systolic pressure of 120 millimeters of mercury and a diastolic pressure of 80 millimeters of mercury. High blood pressure, or hypertension, is defined as a systolic pressure of 130 millimeters of mercury or higher or a diastolic pressure of 80 millimeters of mercury or higher, while low blood pressure, or hypotension, is defined as a systolic pressure of less than 90 mmHg or a diastolic pressure of less than 60 millimeters of mercury. What are the symptoms of high blood pressure? High blood pressure, also known as hypertension, often has no symptoms, which is why it is sometimes called the silent killer. However, in some cases, people with high blood pressure may experience the following symptoms. Headaches, especially in the back of the head and in the morning, can be a symptom of high blood pressure. Dizziness or lightheadedness can be a symptom of high blood pressure, especially if it occurs when standing up quickly. Shortness of breath or difficulty breathing can be a symptom of high blood pressure. Chest pain, tightness, or pressure can be a symptom of high blood pressure, especially if it occurs during physical activity. Blurred vision or vision changes can be a symptom of high blood pressure. Nosebleeds, while not a common symptom, nosebleeds can be a sign of high blood pressure in some people. It's important to note that these symptoms are not specific to high blood pressure and can be caused by a number of other conditions. The only way to know for sure if you have high blood pressure is to have it checked by a healthcare provider. What are the causes of high blood pressure? There are many factors that can contribute to high blood pressure, including age. Blood pressure tends to increase with age, as the arteries become stiffer and more narrow over time. Genetics. High blood pressure can run in families, suggesting a genetic component. Lifestyle factors, poor diet, lack of physical activity, obesity, and smoking can all contribute to high blood pressure. Stress. Chronic stress can cause the body to release hormones that increase blood pressure. Chronic conditions. Certain chronic conditions, such as kidney disease, diabetes, and sleep apnea, can increase the risk of high blood pressure. Medications. Certain medications, including some over-the-counter pain relievers and cold medicines, can increase blood pressure. Hormonal factors. Hormonal imbalances, such as those that occur during pregnancy or with conditions such as Cushing's syndrome or hyperthyroidism, can cause high blood pressure. It's important to note that in many cases, the exact cause of high blood pressure is unknown. This is known as essential or primary hypertension. How to prevent high blood pressure? There are several steps you can take to help prevent high blood pressure. Maintain a healthy weight. Being overweight or obese can increase the risk of high blood pressure. Losing weight and maintaining a healthy weight through diet and exercise can help prevent high blood pressure. Adopt a healthy diet. Eating a diet that is rich in fruits, vegetables, whole grains, lean proteins, and low-fat dairy products can help prevent high blood pressure. Avoiding foods that are high in salt, saturated fat, and added sugars can also help. Exercise regularly. Regular physical activity can help lower blood pressure and reduce the risk of high blood pressure. Aim for at least 30 minutes of moderate intensity exercise, such as brisk walking, on most days of the week. Limit alcohol consumption. Drinking too much alcohol can increase blood pressure. Quit smoking. Smoking can damage blood vessels and increase the risk of high blood pressure. Quitting smoking can help prevent high blood pressure and other health problems. Manage stress. Chronic stress can increase blood pressure. Finding healthy ways to manage stress, such as through exercise, meditation, or counseling, can help prevent high blood pressure. Get regular checkups. Regular blood pressure screenings can help detect high blood pressure early and allow for prompt treatment. What are best treatments available for high blood pressure? There are several effective treatments available for high blood pressure, including lifestyle changes. Making healthy lifestyle changes, such as maintaining a healthy weight, adopting a healthy diet, exercising regularly, limiting alcohol consumption, and quitting smoking, can help lower blood pressure. Medications. There are several types of medications available to treat high blood pressure, including diuretics, ACE inhibitors, ARBs, beta blockers, calcium channel blockers, and renin inhibitors. Your healthcare provider can help determine which medication is best for you. Combination therapy. In some cases, a combination of medications may be needed to effectively lower blood pressure. Monitoring. Regular blood pressure monitoring is important to ensure that treatment is working and to make any necessary adjustments. Lifestyle modifications. In addition to lifestyle changes, your healthcare provider may recommend additional lifestyle modifications, such as stress management techniques or changes to your sleep habits. It's important to work closely with your healthcare provider to determine the best treatment plan for your individual needs. It's also important to continue with treatment even if you don't have any symptoms, as high blood pressure can cause damage to your body over time even if you don't feel any different. Thanks for watching. Please subscribe for more videos.